I'm absolutely thrilled to have some of my favorite friends in the adult congenital heart space come and speak for us today to talk about things that are really going to become important for us in the next coming years, as well as things that are important for us today. So welcome to everybody, and if you are on social media, please go ahead and talk about what we're doing today, because we really want to make this an awareness campaign as well. We can't go through today without talking about what a humongous contribution Denton Cooley has been to this field in general. I would not, as well as many of us here up front, wouldn't have something to talk about today had it not been for Denton Cooley, who passed away yesterday at the age of 96. For those of you who don't know, so he actually participated with Alfred Blalock in one of the very first congenital heart surgeries back in 1944 at Johns Hopkins as the resident on the service. And then he brought congenital heart surgery as we know it to here in Houston, and may have actually played a role in your lives or many of your friends' lives. He was probably one of the first to actually do an open heart congenital heart surgery here in Texas and in the region, and really revolutionized the way we take care of these patients today. So this is an important, unexpected tribute today to him. That's right. So here's what you can expect from today. So as I mentioned, we have our congenital heart disease experts from all around the region speaking to us today about different topics. You're going to get a broad education. And then what I want to make sure that you have an opportunity to do is to meet the communities that can help, as well as you can help them, as far as both on a national level as well as a local level. So I think one of the best things that can come out of today is a networking opportunity where we can help to support other communities, and those communities can continue to help support us. And what I mean by that is Mended Little Hearts, the Marfan Foundation, Adult Congenital Heart Association, Pulmonary Hypertension Association, et cetera, et cetera. And we're going to give some time for them to actually speak on their individual organizations. And what I'd love to do is to see all of us here participate in their fundraising opportunities and their walks and get out the word for that. One of the things that I'm most excited about is going to be the hands-on learning lab that we're going to have upstairs on the 5th floor midway through today's session. And what we're going to do is have all of our faculty help to moderate those hands-on learning opportunities. And this is thanks to our industry support that we can really get you to get your hands on a transcatheter valve, get your hands on a pacemaker, a surgical valve, et cetera, et cetera, et cetera. Some of you, if you want to, you can actually even do an angioplasty on a coronary artery upstairs, as well as do echocardiograms. So hopefully that'll be a lot of fun for all of you. And then the last thing that I really want to mention is that this is an ongoing process. So what we want to do is we want to learn from you, okay? So we want to learn from you, are we doing this the right way? So you're going to get a survey at the end of the day today that we really need you to fill out. You need to tell us, how did we do, and how can we do things better? Because this is going to be an ongoing process. As you've probably heard, this is our second year doing this. We're still learning how to do this, and as with all things adult congenital, we're still learning how to take care of you. So we'd love to learn from you. We'd love for you to teach other people about it. All of this material is actually going to be online on YouTube. So for those of your friends who couldn't make it today, those of your family members who couldn't make it today, please go ahead and share this information once it gets out there and promote it for us, okay? Because the truth of the matter is, even though you may think that you're the only one that you know, that's probably not true. You may actually know somebody else who has congenital heart disease. And so getting the word out there is a really important part of what we all do here.